Thank you so much. And what can I say other than thank you, Dr. Fernandez and the team for absolutely a really inspiring presentation to us all this morning. You've set out so clearly the scale of the task, and it's clear that since 1948, when your parents established the clinic and the institute, you put sort of patient-led care at the centre of everything that the hospital has been doing, the hospitals have been doing, but also you've been looking beyond the borders of the hospital and looking to reach out into the communities and to shape how healthcare is provided right across India. And you've done that with incredibly successful and long-lasting collaborations, both in the state but also internationally as well. And thank you for recognising the support and the natural synergy between the UK and India in so many of these issues. We too learn from you, and that is the strength of the partnership here. And on this issue, just as you have been campaigning so passionately for the role of midwives in births, you are now setting a new standard in leading southern India in the establishment of the RAAHAT Centre. And what I want to say thank you to is not just to you, but also to your partners, and particularly those state organisations that are also represented here today. And this multi-agency approach is the only way that these complex multiple needs of women who are affected by domestic abuse can be addressed. And to have this capability and facility here, to have you working through this single centre, I think will be transformative. And what you will prove you can do together will act as a template across Telangana, but also across other parts of India as well. So we wish you nothing but good luck, and we are here to support you in any way that we can. We look forward to seeing the journey of the centre. We know you will do great things and support many women. It is, as you say, so unfortunate this is needed in all of our countries, but actually bringing all the people who have influence to bear on the solutions to support women is so crucial to our communities. And as you say, it's not just for the women themselves, it's for their children, it's for the others who live in the home, for the economy, and for how our communities flourish and the resilience and the strength of our communities. So thank you all for having us along today. We've learned a great deal. We are going away feeling utterly inspired. Gareth will be keeping close contact and working with you in the months and years to come. So thank you very much for having us.
Words.
Thank you, Maimuna. Good morning and a warm welcome to our esteemed guests, colleagues, and friends from the media. I wish to thank Ms. Christina Scott, the British Deputy High Commissioner, and our guest of honor, Mr. Owen, the British Deputy High Commissioner to Telangana and AP, for gracing the occasion today. It's with great hope and pride that I welcome you to the launch of RAAHAT, a crisis center dedicated to supporting survivors of domestic violence and abuse. For members in the audience who may not be aware, Fernandez Hospital is in its 76th year of existence. Thank you. It began as a 2-bed maternity hospital in 1948, set up by my parents, today with 320 beds. Thanks to the trust enjoyed for over 4 generations, we have helped bring, and this may interest you, 236,541 babies into the world, contributing to perhaps 2% of the Hyderabad population. Yeah. The growing patient volumes, led by teams of committed clinicians and healthcare workers, led to Fernandez being accredited as a national postgraduate training institute for OBGYN, neonatology, midwifery, and neonatal nursing. We also run postdoctoral fellowships recognized by Kalonji University. In August 2018, Fernandez Hospital Private Limited converted totally into a not-for-profit and became the Fernandez Foundation. And under this umbrella, we have all our various verticals of service. I wish to seize the opportunity and share with the audience the deep connection between Fernandez and the UK and our journey with midwifery. In 2017, thanks to the Telangana government and the unconditional support of UNICEF, Fernandez launched the country's first 18-month midwifery training with a cohort of 30 registered nurses working in public hospitals of Telangana. The curriculum was designed to meet global standards of the International Confederation of Midwives. During this training, Mr. Andrew Fleming, the British Deputy Commissioner at that time, visited the trainees in Karimnagar, spoke to them, and then he called it the Living Bridge, two countries working together to save lives. Because all our midwifery trainers at the time were from the UK and assisted by Fernandez faculty. The impact of this program on women and newborns in public institutes fed into the government of India's decision to introduce midwifery across the country, across the public hospitals. And this is no small achievement. So therefore, today, Ms. Scott and Mr. Owen, I wish to publicly announce my deep gratitude to the many midwives from the UK who helped train 353 nurses in Telangana and who are now working in 33 districts across 58 facilities, and also helped to train 70 national midwifery educators drawn from 10 states across India. The success of the program would not have been possible without UNICEF's unstinted support and faith in us. Our mission is to make pregnancy and childbirth safe. And we use the collaborative model of care where midwives, obstetricians, and allied specialists, wherever needed, work together to care for the woman and her newborn. So with a task force of 1,675 employees, of which 70% are women, any wonder we work so hard to make sure that we have an environment where women feel safe and respected. RAAHAT, therefore, is a significant milestone in our foundation's journey in creating a society free from the evils of domestic violence. It remains a critical concern, domestic violence across Telangana. You will hear some statistics from our speakers, casting a shadow on countless lives. Each statistic represents not just number, but a person whose life is affected by violence. RAAHAT Crisis Center is more than just a facility. It's a symbol of our commitment to empowering women, empowering survivors, and offering them a place to find solace, understanding, and hopefully a path towards healing. RAAHAT would not have been possible without the support of Ekta and Vivek Verma of the Invisible Scars Foundation. Thank you. This partnership strengthens our ability to create a comprehensive care network that addresses survivors' emotional and psychological needs and fosters long-term healing. It's a promise of hope and a pledge to walk alongside survivors every step of the way. So thank you, ladies and gentlemen, for joining us on this very important journey. With the support of our partners and community, I urge you to join us in creating a world where every person, particularly the woman, feels valued, safe, and empowered. Thank you.